Hi, in this video, I'll be talking about some of the details about using a cold cap. A cold cap is used during chemotherapy to decrease the amount of hair loss that people get when receiving chemotherapy. We have another video that explains this in more detail. But if you're going ahead with a cold cap, what do you need to do to prepare? And what should you expect during treatment with a cold cap? Well, a cold cap is usually rented by a facility, whether that's the place where you're getting your treatment or a medical supply company. They will rent that to you, then you will take it home, and you'll need to bring in with you the cold cap in dry ice or a biomedical refrigerator. It's a little complicated. You'll want to have somebody come with you, and there are actually paid cappers, in quotes, who can also assist if there's nobody in the family who can help you. We cover whether this is covered by insurance or not in our other video. When you get the cold cap, you'll want to spend some time practicing with it at home. You'll want to review the manufacturer's instructions so it's not all new when you're getting your first chemotherapy. And you'll also want to fit it to your scalp. It's really important that the cold cap make contact with the scalp in order for it to work. So it needs to be fitting quite well. And that's why some practice at home can be really helpful. And having the family member or friend who's going to be with you when you get your infusion can also help. So you're not then telling them what to do and they're not telling you what to do. You're both ready for this. Now, I know it sounds complicated, but after you get it done the first treatment cycle, it's actually pretty straightforward. So again, you'll rent it from a facility, whether it's where you get your treatment or another place. Your doctor's office can help you with that. You'll want to practice it at home. You'll bring it in a cooler that has dry ice or in a refrigerator that's actually part of the rental. And practicing at home can make sure things go really smoothly for you. Now, what should you expect when you're having the cold cap running when you are getting your treatment? Well, because it's very cold, some people can have scalp discomfort or shoulder discomfort because of the tension in the blood vessels. The blood vessels kind of clamp down. That's how it works. So people can have pain in their scalp, pain in their shoulders, or if not pain, some discomfort. I don't want to discourage you from using this, but I think it's important to know what to expect. You may also have, with a cold cap, some forehead pain because, again, all the blood vessels on the scalp are close to one another. The scalp is very sensitive, and this is going on your whole scalp. So you may have some forehead pain as well as some neck and scalp coldness or discomfort. And then there's some other things that are harder to explain at first glance, but kind of make sense. Some people can actually get a little lightheaded, some people can get nauseated, and some people can have headaches. So if you're a migraine sufferer who's sensitive to cold, you may notice that you're getting what feels like a migraine headache. Migraines are caused by blood vessel constriction and then dilation. So the same thing can happen with cold. And if you are sensitive to a cold breeze or cold weather, this may be a trigger for you. And that may be in part what causes some of the dizziness and nausea. It may be related actually to the same thing that can cause headache. Now, because it's quite cold and because we have a lot of surface area on our head, your whole body is likely to get chilled. So you'll want to wear warm clothes, including warm socks, and you can bring in a blanket of your own. A lot of treatment centers themselves will have blankets for your use. And being prepared and asking for this before you start your infusion can just decrease the time that you're waiting for this. I'd like to talk now about how to take care of your hair if you are using a cold cap, and frankly, even if you're not, a couple things to know about taking care of your hair when you're undergoing chemotherapy. a lot of people find that it's helpful not to wash your hair as frequently. So, a lot of us wash our hair every day, and you may find that you want to wash your hair a little less frequently during chemotherapy. For example, every other day. We recommend that you not use a curling iron or hot curls or any curls or a rough brush on your hair. You want to be extra gentle. Use a gentle shampoo. Baby shampoo is actually not the most gentle shampoo there is out there. You can look on your shampoo products and make sure you find one that's very gentle. And then be really careful how you handle your hair. Again, decrease the amount of brushing or combing that you do, and try not to manipulate the hair. So while you may want to put it in a ponytail, really tight braids can be really tough on the hair. I know this can be hard if that's how you're used to wearing your hair. And it's just one more thing to be sad about. And I want to validate the experiences that you're going through. But just be real gentle with your hair, and that can decrease the amount of hair loss you have, at least in the beginning. And with a cold cap, that may help throughout the entire treatment course. We also recommend that you not dye your hair for the same reason. It's a lot of manipulation and tugging, even if it's done gently with foils and a brush. We want to avoid, especially with your hair as it's growing in or getting thicker, we want to avoid treatments to the hair that might sort of make them bail on you a little early or fall out more frequently. I hope this has been helpful. I know it's a lot of information. If it's been helpful, click like and subscribe. Liking will help you see other videos like this. Subscribing will also do the same, and liking helps other people just like you find these videos. As always, you can go to yerbba.com to get your personalized report and drop a comment or a question below.